When you're in the deployed setting, sometimes you have to go out of your comfort zone.
Gunshot wounds, stabbings,
burns, trauma.
Patients that have a lot of issues going on that require a lot of extensive care.
Most of the people I was with have never even seen trauma before, much less been deployed.
I have seen folks when I have deployed myself, first time deployment, and they're like deer in the headlights.
One of the difficulties is in a medical treatment facility in the military, the acuity of the patients is pretty low.
Most Air Force facilities where nurses are working in clinics or even in hospitals don't have traumas or patients with gunshot wounds, things like that, that we would see in a deployed environment.
We have a very healthy population, so our population usually are not very critical.
Even if you have this great training, if you don't have continued exposure or experience to sick patients, then you forget.
So in order to make us medically ready to be deployed and to deal with trauma in the field, they send us to programs such as SMART.
SMART stands for Sustained Medical and Readiness Trained. And what that means for our program here in Las Vegas is we are involved with training medical providers, nurses, and technicians so that they can maintain their skills in medical care of patients.
They have military personnel, registered nurses, and techs that come onto the unit to train with us here at UMC to help build their skills so that when they're ready to go out into the field that they can utilize those skills there.
It brings in people from all of the MTFs around the world.
And that includes Air Force surgeons, nurses, OR techs.
They get to learn different specialties, coronary, cardiac. They work through the trauma recess area, the emergency department, and they also work with the pediatric patients.
University Medical Center is the highest level of care in the state of Nevada, so you're able to get exposed to all types of acuity and injuries here at our hospital.
There's a fair amount of penetrating trauma here, and so they get to experience what a gunshot wound looks like, or a knife wound looks like. And some of the injuries we get here are pretty serious.
Trauma patients, burn patients, also our neuroscience care unit, so you have patients with traumatic brain injuries, flap patients, which is plastic surgery, and ENT, which is the ear, nose, and throat specialty. So there's a wide variety of patients that they're going to be training with.
The training structure here at the SMART program is rotators come for a 2-week period. We have 14 2-week periods throughout the entire year, and so people will sign up through their readiness department.
There is a application process that you do have to go through.
We did a self-assessment of what are my strengths, what are my weaknesses, and then based off that, the instructors in the SMART course were able to kind of give me a schedule for the next 2 weeks in the SMART course that allowed me to hone in on those skills that I don't get in the everyday medical facility.
Instructors or their leads in the SMART program will work with charge nurses and clinical supervisors and try to place their nurses in a unit. They actually know their nurses and know what their strengths and their weaknesses are. So they assign their nurses to the units according to the needs for learning.
That's the benefit, is we can kind of tailor it so that master sergeant who hasn't scrubbed in 10 years, we can start them off light, and once they're past like the shakes and they're ready for a traumatic or a more high acuity case, we'll transition them in there.
So they'll say, oh, this nurse has had maybe coronary or cardiac experience and maybe they need more burn. Well, this nurse has had burn before, but she just wants to refresh and up on some burn, so they'll put her on the burn unit.
They try to put you in units where maybe you would like to experience and get some of those skills.
I really enjoyed the instructors, the way that they kind of tailor-made the program for me as a critical care nurse, making sure that I had the best experience possible. If I needed to learn something, they would ask me, you know, what are you kind of weak on? And I'd tell them, and they'd be like, okay, we're going to find that patient for you.
The relationship with the students in the SMART course and the nurses here at UMC is awesome. They take the time to teach us without feeling that we are stepping on their toes.
Many of them are grateful that we're here. They have heavy loads. There's a lot of patients. They're understaffed in some cases. And so having an extra set of hands to help do things is very helpful to them.
The relationship between the MTF here in Las Vegas and UMC is probably the most integrated relationship I've seen in my career between a military and civilian institution.
It allows Air Force medics to be embedded into our hospital, which is University Medical Center, and work side by side with our clinicians to provide care to our community.
The nurses and the technicians who come, they're not right out of school, so they have some experience. And so when they come, it's not like they're just students. They actually are contributing to the healthcare. They're supporting UMC.
The benefit that UMC gets is we get the extra help, and we get to know these people who are sacrificing for our country and serving in the military, and just to be able to educate them and help them is a service that we are doing for our country as well.
It's just really nice to see that it's not one-way learning. It's not the Air Force learning from what's happening in a trauma center or burn center, but it's also we're learning from the Air Force as well. It's a great partnership, and the Air Force is really our family here at UMC.
The SMART program contributes to the overall mission by ensuring that all individuals that come through it have the chance to become proficient and they're ready for missions, whether or not it's at the military center or they're prepared for deployments and readiness.
You've done it, you've seen it, you feel comfortable, so now when you're downrange, you're not as shell-shocked about it.
It allows us to come to a place and really focus on keeping our trauma skills up, which are what we really need when we're in the deployed setting.
I believe the SMART program prepares people for deployments. It will not prepare them for everything they will see, but it gives them a chance to be exposed to something first.
It's one of the things that we don't really look at coming in nursing is the emotional side and what nurses deal with on a day-to-day basis. And so being able to prepare ourselves definitely helps us when we're deployed.
I actually had a airman who texted me from deployment, and the things that they saw here in the SMART program and the equipment that we went over, they actually utilized it.
I have had students email me from Bagram, Afghanistan, when they've been down there saying thank you for all the skills that you've provided.
And so they're getting a good perspective, good clinical experience, good interventions here at University Medical Center.
We all went into medicine and to healthcare to take care of sick patients. And sometimes it's frustrating for folks who are used to take care of or want to take care of sick patients to not have that experience. So for them to come over here routinely and to be able to take care of sick people makes them better providers, but also makes them happier in their profession.
To be able to have the Air Force taking care of their community in a way that is very special, I think the patients see that they're in trusted hands with the Air Force medics, along with our skills at UMC.
Anytime you're in a medical field, you have to be educated, you have to be up to date on current evidence and what's going on.
We're really doing things that nobody has done before here. And I think this is going to be the flagship or the example moving forward how to integrate the military and the civilian in the future, and will make the mission of the line or anywhere else in the Air Force successful.
The SMART program is saving lives.